Hi. Today we are going to focus on the ethics of truth-telling. First, let's watch a manga clip in which Kanami's family receives dire news about Kanami's grandfather.
Today, I'd like to talk to you about the current state of Mr. Hideo's body. Up until now, we've run several tests. Please look at this CT scan. Here, you can see a white circle about 3 centimeters wide. There are also a few more in other places. This is lung cancer. It seems like Mr. Hideo used to be a heavy smoker. The cancer has spread to the rest of his body already, so removal through surgery is impossible.
How much longer does Dad have left?
We are considering using aggressive therapy and chemotherapy that utilize anti-cancer drugs, but even with that, I'd say he has from 6 months to a year left. If we go with therapy that will lessen his suffering, that will give him 3 months.
Grandpa, he has hardly any time left.
If we perform therapy with anti-cancer drugs, there will be a side effect. So we need his consent before we can do anything. But even before that, we need to tell Mr. Hideo about the cancer itself. However, due to his old age, the therapy may cause him a lot of suffering. Should we tell him or not? Please discuss this as a family.
Are we going to tell him?
I think we shouldn't tell him.
Me too. I don't want him to get so shocked that he dies even quicker. It's better if he enjoys the rest of his life without thinking about the cancer. It will be better for his state of mind. And maybe a miracle will happen and he gets better. They say that disease comes from the mind, right?
I think that as long as there is some kind of chance, we should keep trying the therapy. Which means that he needs to know that he has cancer. And even if it gets to the point where nothing more can be done, telling him the truth will allow him to live his last days in the most meaningful way possible. So I want to tell him exactly what his illness is.
What do you think, Kanami?
I want him to live as long as possible too, but...
Along with heart disease and cerebrovascular disease, cancer or malignant growth is one of the 3 leading causes of death in Japan. Today, with advances in surgery, chemotherapy, and radiation therapy, there is a greater potential to treat cancer if it is detected early. Nevertheless, the reality is that 1 out of 2 Japanese will get cancer, and 1 in 3 will die of cancer. When cancer was considered an untreatable illness, it was common for physicians to inform the patient's close relatives, but not the patient. Patients with stomach cancer were often told that they had different illness, such as a gastric ulcer. Roughly 50 years ago, people began to discuss the pros and cons of cancer disclosure. Around that time, cancer was becoming increasingly more treatable when detected early, and thus some thought that patients should be informed for reasons related to treatment. Yet, it was reported at the time that many participants in a Japan Society for Cancer Therapy Symposium felt that it was still too soon to notify cancer patients, because such a diagnosis was tantamount to a death sentence. Roughly 30 years ago, the first public opinion survey about cancer treatment was conducted. According to this survey by the Health and Welfare Ministry, currently the Ministry of Health, Labor and Welfare, 56% of people said that they would want to be informed if they were found to have stomach cancer. On the other hand, if they found out that a member of their family had stomach cancer, less than 20% would inform the person, and over 40% would not inform the person with cancer. A survey by a national newspaper about 15 years ago found that 76% of people would want to be told if they had cancer, and 37% would inform a family member with cancer. This indicates that the number of people who desire to be informed of their condition is rapidly rising. Similarly, about half of the physicians now say that patients should be informed if they have cancer, which demonstrates a major change in how doctors have come to think compared to 45 years ago. A famous and symbolic case in which cancer disclosure did not take place involved the Showa Emperor of Japan. Cancer was found in his pancreas in 1987. Even though the physicians involved in the treatment, the Imperial Household Agency, and even the mass media knew this, it was not reported until just before his death in 1989. The attending physician later recollected that not even the emperor himself realized the truth. In contrast, when the current emperor was found to have prostate cancer in 2002, the emperor was notified and it was reported in the press immediately. It was partly because there was high likelihood that it could be cured, and because notification of prostate cancer occurs in almost all cases.